So you're thinking about trying Chinese medicine, maybe visiting an acupuncturist, a Chinese herbalist, and you're not sure what to expect. Well, you've jumped into the right video. This video is for you. I'm Marie Hopkinson. I'm a herbalist and an acupuncturist in Australia. I've been doing this job for over 23 years, and I have been in full-time practice all of that time. Plus, I teach Chinese medicine. I train future students, and I've been doing that for at least 16 years, probably more. So let's get into the video. Just told you that so you know I'm not just some rando person that kind of doesn't know what they're talking about. So when you come in to see an acupuncturist, now I want to give you a little disclaimer. Look, results can vary, like as in not results of the treatment. Obviously that varies too, but like there'll be a general step-by-step process that's kind of followed, and this can change from practitioner to practitioner, but ultimately it will be go along something like this. So you come into the consult, and the first time you see a practitioner, there's usually more time than subsequent visits because there's time for you to kind of talk about the stuff. And one of the big differences between most Western medicine practitioners, even many chiropractors, physiotherapists and things like that, is most acupuncturists and herbalists allow more time for patients to talk about stuff. And because we want to know things that you might not think are relevant, but Chinese medicine practitioners think those things are relevant, and they become part of the diagnosis. So we're not counsellors, but often it can be almost like therapeutic like that because people get to tell a bit of their story, what's happened. So this depends on what's going on with you, how long you've had this illness for. Have you got lots of things that you've sort of saved up to see a practitioner, or are you sort of regularly seeing a practitioner? Maybe you've seen someone else before. So generally there's a bit of time to do that. So the practitioner is going to ask you what the main thing that's bothering you, and then are there any other health problems and other things that are bothering you? What do you want to treat with what things, for instance? So that might be kind of a part of a discussion. And you might think, well, I don't know what things there are to treat with those things. So let's talk about that. So acupuncture is one of the modalities of Chinese medicine. Now, within acupuncture, there's things like moxibustion, there's cupping, there's a gua sha or channel scraping, channel rubbing. There's other manual type of therapies that might be part of acupuncture, but then we're kind of moving into acupressure, which is actually pressing points or massaging the body. So that's another branch. We've got two branches. We've got acupuncture and Tuina or Chinese massage. And then another branch is herbal medicine. So you see some herbs behind me, and then how the herbs are dispensed might be depending on the style that practitioner does or what's best for you. So for instance, these herbs here that you can see here next to me are raw herbs, and we also have these raw herbs can be ground into a powder, and you might have to eat that powder down or drink it down. And then there's other ways where you might boil those herbs up, or the common way at the moment is granules. So that is like they've already been boiled up and they're freeze dried into a granule. And then there's all kinds of pills and capsules and things like that are made. Now there's traditional ways of making those pills where the raw herbs would be ground into a powder and then it's mixed with honey, and then you kind of just chew those pills down. That's the actual way that they used to make pills in the Han Dynasty, the origins of Chinese medicine, the documented origins. Chinese medicine has been around a long time, more than 2,500 years, but it basically became more formulated and more documented in the Han Dynasty. And that's where most practitioners get their original ideology or concepts of what Chinese medicine is about. And we'll probably save that for another video. How does a Chinese medicine practitioner think? So when you visit the practitioner, you're going to have a chat. They're going to talk to you about those things, and they may explain some of those things as they go along, or they might sort of save that to the end and give you a bit of a summary. Okay, this is what's going on. These are the best ways we could treat you. So we've covered acupuncture, we've covered Tuina, Chinese massage, and we've covered herbal medicine. Well, what are the other two? So the other two are lifestyle intervention type of things. So we've got diet therapy, which is using foods as medicine. And this is one of the branches that I tend to talk about a lot on this channel because it's something that, people can get pears at the shops and make pears for dryness in their throat. So that there might be food-based treatments that are used, or it might be kind of looking at how your diet maybe interacts with the herbal formula that you're taking. That's one of the considerations we do. And also to think about what are your goals. Maybe you are coming in for something metabolism-based and we think, okay, this diet would be best to suit you. So that's another branch. And the final branch is exercise therapies, or Qigong and Tai Chi. So originally these methods were used to keep people healthy. These last two methods were like self-care, if you like, or self-help. Now, these are 5 branches of Chinese medicine. There's another theory or ideology that talks about 8 branches. We won't go into that this video because we're just trying to keep it to what will be relevant to you as a patient, a person coming in to receive an acupuncture or herbal medicine treatment, essentially. So some practitioners do just practice diet therapy, dietetics, or Chinese diet therapy. It's got lots of names. But most practitioners use that alongside of the modality they use to treat you, because dietetics is not technically, for the most part, a treatment-based therapy. It's much more of a prevention-based therapy. So these two things go hand in hand. So the practitioner might say, do this with your diet or eat these foods and that will help, alongside of here's some acupuncture based things. So it could be cupping, it could be moxibustion, it could be gua sha, it could be, and then within acupuncture, there's many different modalities. So that in itself should answer the question, what's the difference between acupuncture and dry needling? Dry needling doesn't contain any of the stuff I just mentioned before, except for the actual where the needles are going. And the diagnosis is not based on Chinese medicine. Right, so we've had the consultation. Now, what happens in the consultation? Okay, the practitioner is going to ask you some questions, but the two main, most important special things about acupuncturists and herbalists is they're going to look at your tongue and feel your pulse, so your pulse diagnosis. Tongue and pulse diagnosis, they're unique things to Chinese medicine. They're part of the Chinese medicine philosophy. It doesn't belong to any other modality. They're kind of unique. In my particular practice, pulse diagnosis is highly relied on. So we might do that more upfront in the consult, not sort of at the end. But many practitioners will use a combination of both of those things, or somewhat in those things. I don't really use tongue diagnosis much in my practice. I very occasionally will use it to rule out or confirm a particular diagnosis. So again, the reliance on these different modalities might be different between different practitioners. For instance, if you see a Japanese influenced Oriental medicine practitioner, so they'll be practicing Chinese medicine, but maybe more Japanese style, they'll do a lot of palpation. So they might touch your abdomen, they might get you to lie on the table and press on your abdomen, not painfully, it's not going to be poking you really hard. It's just going to be touching you, feeling what's hot, what's cold, maybe feeling where there might be tightness or pain for you or things like that. That's a part of diagnosis. And we call that palpation, which means touching, right? Pressing. And so the pulse is part of palpation. And then again, another part as we move into the treatment, sometimes this is done before the treatment begins or as it begins, is the practitioner is going to probably touch you where the acupuncture needles might go. And some modalities of acupuncture require us to press on the channels, like let's say we might think we're going to use this area, but we're not sure which point is the right point for you until we press it and find the most painful point. And that particular style usually belongs to distal needling type of acupuncture therapy. So there's a myriad of practitioners who do that. Dr. Tan balance method is probably the most popular one, but it's not the only one. And there's many kind of styles of this distal needling acupuncture. So you can get a big variance between what a practitioner will do because it depends on their line of training. But it all comes back to the same ideology or the same concepts, the same fundamental concepts. And what are those fundamental concepts? They are that we see you as interacting in the environment. We see illness as an imbalance of your body's ability to make it to maintain its health. So we believe that human beings should live 100 healthy years, and that yet disease or illness kind of happens to us, but then our body should literally bounce back and be healthy. And the reason why it might not do that is because maybe the environment, either the environment you're putting into it, like your food, or sometimes even emotions and things like that can be part of that scenario. That's making it hard for your body to restore the balance. Or something's been going on a long time and you haven't restored the balance soon enough, and then now a real more serious problem has happened. A good analogy I use for my patients is if you have a car and it starts to run out of a vital fluid that it needs, like petrol would be an obvious one, your car will just stop running. But oil, it won't just stop running, but your oil, let's say your oil light goes on. I used to have a really old car and that would happen to me when I was younger. And I'm like, oh, just ignore it. Don't worry. The lights are always on. People would get in my car and say, Marie, the emergency light's on. I'm like, it's always on. just an old car. I was just expecting it to die. So don't treat your body like an old car, like, oh, the oil light's always on. Well, that's a warning. Something's wrong there, and you should just address that. So if you put the oil back in, and that's kind of like you go to an acupuncturist or a herbalist and you get something sorted out as soon as it happens or earlier, well, then you don't need lifelong treatment. You don't need a long-term treatment plan. You just kind of, soldier on and go back to your life, and everything usually the balance kind of restores. And sometimes this could be from foods or exercise therapy, right? Just even doing exercise is a therapy for people, like going for a walk. And then, if you didn't go for that walk like for years and years and years, well, you might get overweight. And then you've got other issues, metabolic issues and things going on that are not just as simple as, okay, we're going to just readdress this balance. Because like the oil analogy, if that oil's dried, like the car can't function, and then something's going to break in that car, overheat, and then you're going to have a serious problem. You're going to blow a head gasket or something like that. And the only reason I know about was a head gasket is because it's happened to me before. So yeah, you need to get your car checked regularly, and you also need to get your body checked regularly, or be in a self-checking mode, right? So I'm not saying you have to go and see a practitioner to do these things, but being aware of that means you can address that stuff. So getting back to what happens when you see an acupuncturist or a herbalist is they're going to ask you some questions. They're going to feel your pulse. They're going to look at your tongue. Maybe they're going to put you on the table and maybe press on some points or press on some areas, and then they're going to prescribe you a treatment. So they're going to hopefully give you informed consent, which means they're going to explain what it is, and then you say, yeah, I agree to that, I want to do that, right? And they're going to probably discuss some kind of treatment plan with you. How often do I need to do this? How often do I need to take these herbs? How long do I need to take this for? And that's very individual to what's happening in your scenario, in your situation, and also how that practitioner works in what they do. So if you take herbs and do acupuncture, then maybe the acupuncture doesn't need to be as often. That's what I see in my practice the most commonly. If I see patients who don't do herbs, they need to do acupuncture at least once a week for something significant to happen, for the most part, right? If they do it less than that, it's not going to be as fruitful, as good. So that's essentially what's going to happen. Shouldn't be too much woo-woo or mystical stuff.
I'm getting round to that in my own good mystical time.
So hopefully this video has been useful and helpful to you to discover what it might be like to see an acupuncturist. Please subscribe to the channel. Really appreciate that, your support in that area. And if you've got a question about what might happen or something about Chinese medicine, that's what I do on this channel. I answer people's questions. So you can leave that in the comments below, and look forward to seeing you on another video soon.